Dooley Noted, 12/6/2014. Hi, I'm Dr. Kathy Dooley. I'm here with the amazing Mark Andreessen. So tell me a little bit about yourself and your training.
Recently went to SFG2 and didn't do so well. So where we are now is just backing everything down to core strength, breathing, and then go from there.
Mark and I have a similar issue. We both like to go into our low backs. We were partners for our SFG2 training, so we caught each other's disease here with too much extension of the back. And what happens is that people lose the ability to counternutate the pelvis. And what that means is being able to take the pelvis and pull it forward and be able to bring the ribs down, bring the pelvis forward without bringing your thorax with you. A lot of people compensate with their necks, with low back facilitation, and so you end up with these things called a lower cross syndrome, where you have too much of this and not enough of this. But this can be trained, right?
Absolutely.
Mark and I were working together, and we were working on trying to increase counternutation and abdominal facilitation in the front. And you had a little bit of trouble with the lumbar roll, right? You want to demonstrate the lumbar roll?
Sure.
Yeah, so let's get down. We'll do it together.
We call it a lumbar flop.
Lumbar flop. So in this drill, you're trying to pull the ribs towards the hips, but not bring the thorax with you. You're trying not to overly facilitate the neck, and you're trying to grab the legs, so it looks a little bit like this.
Control of the pelvis, integrating with control of the rhythm.
You're leading the movement of the eyes, but you'll see my back doesn't move quite a bit. I'm trying to keep my pelvis in a counter-nutated position, and I'm not overly using my neck. But when Mark gives it a shot, go ahead, Mark.
Here's the don't.
See, it's very ploppy. The sacrum hits the ground. You can actually hear it. And he tries to use quadricep strength and a little bit of neck facilitation to get there. And you've actually improved that quite a bit. It used to be like you would slap the ground. So we're splitting hairs here, but you came up with a great modification of that drill. Can you put me through it?
Sure.
Great.
Yeah.
Okay, so
And this one
what we're doing is we're putting this
on the feet.
So
this
this
is the great Coke resistance band.
I'm keeping it about level here. So you're not pulling up or down because you don't want these here. Now, because of the flop, and I was having difficulty, and Kathy prescribed, if that's the right word, the egg roll, which you saw at home. I got to thinking, how am I going to stay friends with the neighbors, because they're here just pounding on the floor for my roll.
Right.
I just thought about this, give a little assist. So here's your assist. This is pulling on Kathy's feet here. From there, she's going to flatten her back out.
Pulling the ribs down gently, but not flexing my thorax.
And just using as much assist as she needs here, and then just rolling the hips. And then real gently like that. So it's the initiation for me.
So we'll take a look at it.
I was compensating. I was using a lot of neck. You probably saw on the neck, some arms, anything possible to get the motion. This takes all of that out. And just the essentials. So it really is deep into the hip, and you learn how to initiate the core.
This is a fantastic core drill. I can feel this in my abdomen. I can feel my sacrum actually going into this counter-nutated or posterior pelvic tilt position. And I'm not overly using my jaw, my face, my neck. One of the problems with the crunch is that a lot of people do it with their neck, do it with their shoulders, and they can't get this good anterior abdominal facilitation while also pulling the pelvis forward. So, yeah.
I just anticipated a question or a comment. Here, let's put this down. Because I heard myself say flatten the back to the floor. What do you think?
Yeah, don't flatten your lordosis ever.
I want to watch for that.
Yeah.
Maybe a rolled up towel.
Yeah, a rolled up towel is good, or if your hands are free, put your hands behind your back to maintain your lordosis, but you never want to lose your lumbar lordosis. You earned that lordosis when you started walking and crawling, you don't want to lose it. So definitely.
So my apologies
good
for
point.
saying flat back. I knew that.
You meant pull ribs down and not lose lordosis.
That's exactly
right. So give this a shot. This is a great drill if you're experiencing too much lumbar extension facilitation, a little bit of low back pain when you go in extension, and you're getting the plot on the rolls where you're trying to get your abdomen stable. I think Mark's modification with the Cook band is fantastic.
Let's just get into a rocking chair.
Yeah, rocking chair is a great way to put it. Thank you so much, Mark. Dr. Kathy Dooley, I'll see you next time.